You might not know its name, but you've likely encountered it before. It's a silent invader, often overlooked and mistaken for other common ailments. It's not the flu, and it's not a common cold. This virus can easily be confused with these more familiar illnesses because the symptoms are so similar. It's HMPV, and it's a lot more widespread than you think. Human metapneumovirus, or HMPV, is a respiratory virus that has been circulating in the population for decades, yet remains relatively unknown to the general public. This virus can mimic the symptoms of other respiratory illnesses, often making it difficult to diagnose. Doctors frequently mistake it for the flu or a severe cold, leading to misdiagnosis and mistreatment. HMPV stands for human metapneumovirus. Discovered in 2001, this virus has been found to be a major cause of respiratory infections worldwide. It's a respiratory virus that affects people of all ages, but it can be especially tough on young children, older adults, and those with weakened immune systems. These groups are more susceptible to severe symptoms and complications. In fact, almost everyone has been infected with HMPV by the time they reach the age of 5. This widespread exposure means that the virus is constantly circulating within communities. This virus is a master of disguise, often hiding in plain sight. It spreads through respiratory droplets, making it easy to contract in crowded places like schools, public transport, and workplaces. It causes a range of respiratory illnesses, from mild cold-like symptoms to more serious infections like pneumonia and bronchiolitis. The severity of the illness can vary greatly from person to person. Knowing the signs and symptoms is crucial for early detection and treatment. Awareness and understanding of HMPV can lead to better management and care, reducing the risk of severe outcomes. HMPV, or human metapneumovirus, is a relatively recent discovery in the world of viruses. It was first identified in 2001, which means we're still learning about its long-term effects and best treatment options. This virus belongs to the same family as the respiratory syncytial virus, RSV, and shares many similarities with it. Since its discovery, researchers have been diligently studying HMPV to understand its behavior, transmission, and impact on human health. The virus primarily affects the respiratory system, causing symptoms that range from mild cold-like signs to severe respiratory issues, especially in vulnerable populations such as young children, the elderly, and those with weakened immune systems. However, we've made significant strides in understanding how it spreads and who's most vulnerable. Studies have shown that HMPV is highly contagious and can spread rapidly in communities, particularly in settings like schools, daycare centers, and nursing homes. Like many respiratory viruses, HMPV spreads through respiratory droplets released when an infected person coughs or sneezes. These droplets can travel through the air and be inhaled by people nearby, leading to new infections. These droplets can land on surfaces where they can survive for a short period, or they can be inhaled by those nearby. This makes it crucial to maintain good hygiene practices, especially in public places. Currently, there is no vaccine available for HMPV, making prevention strategies all the more important. Frequent hand washing, covering coughs and sneezes, and using hand sanitizers are effective ways to reduce the risk of infection. It's also important to disinfect commonly touched surfaces regularly. Avoiding close contact with sick individuals is another crucial step in minimizing the spread of this sneaky virus. Social distancing measures, staying home when feeling unwell, and wearing masks in crowded places can also help protect yourself and others from HMPV. By staying informed and practicing these preventive measures, we can collectively reduce the impact of HMPV on our communities. HMPV, or human metapneumovirus, can be tricky to diagnose because its symptoms often resemble those of other respiratory illnesses. This virus is particularly common in the winter and early spring months, making it easy to confuse with the common cold or even the flu. It commonly starts with a runny nose, which can be quite persistent and bothersome. Soon after, a cough may develop, which can range from mild to severe, and a fever might set in, causing discomfort and fatigue. These symptoms can last for a few days or up to a week, making it difficult to distinguish from other viral infections. In some cases, HMPV can lead to more serious complications, especially in young children, older adults, and individuals with underlying health conditions. Wheezing, difficulty breathing, and increased respiratory rate are common signs of complications. Chest pain and wheezing are particularly concerning as they may indicate that the infection has progressed to a lower respiratory tract infection like bronchiolitis or pneumonia. These conditions require prompt medical attention to prevent further health issues. If you or someone you care for is experiencing persistent or worsening respiratory symptoms, it's essential to seek medical attention. Early diagnosis and treatment can significantly improve outcomes and prevent complications. A healthcare professional can properly diagnose the illness and recommend the appropriate course of treatment. This may include supportive care, medications to relieve symptoms, and in severe cases, hospitalization to ensure adequate oxygenation and monitoring. HMPV is highly contagious and spreads easily from person to person, primarily through close contact. When an infected individual coughs or sneezes, they release tiny droplets containing the virus into the air. These droplets can travel up to 6 feet and infect others who inhale them or touch surfaces contaminated with the virus. This is why practicing good hygiene, such as frequent hand washing and covering coughs and sneezes, is crucial in preventing the spread of HMPV. The virus can also survive on surfaces for a short period, so it's important to disinfect frequently touched objects and surfaces, especially in homes and healthcare settings. Section 5. Vulnerable populations. Who's at higher risk? While anyone can contract HMPV, certain groups are more susceptible to developing severe complications. Infants and young children, particularly those under the age of 2, are at increased risk due to their developing immune systems. Older adults, especially those with underlying health conditions such as heart or lung disease, are also more vulnerable to severe HMPV infections. Their immune systems may not be as robust, making it harder to fight off the virus. Individuals with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are at the highest risk of serious complications from HMPV. It's crucial for these individuals to take extra precautions to avoid exposure to the virus. Section 6. Battling back treatment and home remedies. Currently, there is no specific antiviral medication available to treat HMPV. Treatment primarily focuses on managing the symptoms and providing supportive care to help the body fight off the infection. Over-the-counter medications such as pain relievers and fever reducers can help alleviate discomfort. Rest, fluids, and a humidifier or cool mist vaporizer can also help soothe symptoms and prevent dehydration. In severe cases, hospitalization may be necessary to provide respiratory support, such as oxygen therapy or mechanical ventilation. Early detection and treatment are crucial in preventing complications and promoting a speedy recovery. Section 7. Prevention is key. Keeping HMPV at bay. Preventing the spread of HMPV relies heavily on practicing good hygiene and taking common-sense precautions, especially during peak season, which typically runs from late fall to early spring. Frequent hand washing with soap and water for at least 20 seconds is one of the most effective ways to prevent the spread of germs. If soap and water aren't readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used. Covering coughs and sneezes with a tissue or the crook of your elbow helps prevent the spread of respiratory droplets. Used tissues should be disposed of immediately, and hands should be washed thoroughly afterward. Section 8. Research and Hope. The future of HMPV management. While we've made significant progress in understanding HMPV, research is ongoing to develop effective treatments and preventive measures, such as vaccines and antiviral therapies. Scientists are working tirelessly to unravel the complexities of the virus, studying its genetic makeup, transmission patterns, and potential drug targets. Clinical trials are underway to evaluate the safety and efficacy of promising vaccine candidates. The development of a safe and effective vaccine would be a game changer in the fight against HMPV, particularly for vulnerable populations. Until then, continued research and public awareness are crucial in minimizing the impact of this common yet often overlooked virus. Section 9. Stay informed, stay healthy. Your wellness is in your hands. HMPV may be a common virus, but that doesn't make it any less important to take seriously. By understanding the virus, recognizing the symptoms, and taking preventive measures, we can all play our part in reducing its impact. Remember, knowledge is power. Staying informed about HMPV, practicing good hygiene, and seeking prompt medical attention when needed are the keys to protecting ourselves and our loved ones from this respiratory foe.